Today's topic is abdominal aortic aneurysm. Abdominal aortic aneurysm typically doesn't cause any symptoms until it ruptures, which can be a medical emergency. However, if the aneurysm grows larger, some people may experience abdominal or back pain, and also pulsating sensation in the abdomen or sense of fullness or discomfort in the abdomen. The pathogenesis involves weakening of the wall due to factors such as aging, high blood pressure, smoking, and genetic factors. Treatment depend upon the size of the aneurysm and whether it has ruptured. Small aneurysms that aren't growing are simply monitored with regular imaging studies, while larger aneurysm require surgical repair or endovascular stenting to reinforce the weakened area of the aorta and prevent rupture. Today's topic is anthrax. Anthrax is caused by the spore-forming bacteria Bacillus anthracis, which can infect humans through skin contact, inhalation, or ingestion of contaminated meat. The symptoms of anthrax include flu-like symptoms, swelling and redness, shortness of breath, chest discomfort, coughing, and nausea. Treatment includes your antibiotics such as ciprofloxacin, doxycycline, or penicillin. In severe cases, hospitalization is necessary and a vaccine is available for anthrax, which is recommended for people who are at high risk of exposure. Today's topic is asbestosis, a chronic lung disease caused by prolonged exposure to asbestos fibers. The symptoms of asbestosis include shortness of breath and a persistent dry cough. Asbestos fibers can cause scarring inflammation on the lungs, making it difficult for them to function properly. While there is no cure for asbestosis, treatment can help manage symptoms and slow the progression of the disease. Medications include anti-inflammatory drugs, oxygen therapy, and pulmonary rehabilitation. Today's topic is acne. Acne is a common skin condition that causes pimples, blackheads, and whiteheads on the face, neck, chest, and back. It is caused by a combination of factors including excess oil production, clogged pores, bacteria, and inflammation. Treatment options include your topical creams and gels containing ingredients like benzyl peroxide, salicylic acid, or retinoids. In severe cases, oral antibiotics or isotretinoin is given. Lifestyle changes such as washing face twice a day and cleansing your skin and avoid picking or squeezing pimples also improve symptoms. Today's topic is anxiety. Anxiety is characterized by excessive worry, fear, and apprehension that can cause physical symptoms such as rapid heartbeat and sweating. The pathogenesis of anxiety involves a combination of genetic, environmental, and psychological factors, including abnormalities in neurotransmitter systems and environmental stressors. Treatment typically involves a combination of psychotherapy, medication, and self-help strategies. In drugs, SSRIs are also given, and seeking professional help is important for the management of anxiety symptoms. Today's topic is Addison's disease. It is a rare condition caused by damage to the adrenal glands, typically caused by an autoimmune response. Although other factors such as infection or cancer can also cause damage. This results in deficiency of cortisol and sometimes aldosterone. Symptoms include chronic fatigue, weight loss, hyperpigmentation, low blood pressure, muscle and joint pain. The main treatment is hormone replacement therapy with cortisol and aldosterone medication. Today's topic is allergic rhinitis, also known as hay fever. It is a condition caused by an overreaction of the immune system to allergens in the air. The symptoms of allergic rhinitis include a runny or stuffy nose, sneezing, itchy eyes, nose and throat, and post-nasal drip. Treatment options include avoiding allergens, over-the-counter medication, and immunotherapy in severe cases. With proper management and treatment, many people with allergic rhinitis can effectively control their symptoms and improve their quality of life. Today's topic is Alzheimer's disease. Alzheimer's disease is a progressive and degenerative neurological disorder that affects memory, thinking, and behavior. Its symptoms include memory impairment, difficulty with language, poor judgment, personality changes, and problems with daily activities. The cause is not fully understood, but is believed to be a combination of genetic, environmental, and lifestyle factors. There is currently no cure for Alzheimer's disease, but treatment focuses on managing symptoms and slowing the progression of the disease using medication. Today's topic is appendicitis. Appendicitis is a medical condition characterized by sudden severe pain in the lower right side of the abdomen. Its symptoms also include loss of appetite, nausea, vomiting, fever, and diarrhea. The condition is caused by the blockage of the appendix, which can result in bacterial infection and inflammation. The most common treatment is surgery to remove the appendix. Antibiotics are also given in some cases. If anyone is suspected to have appendicitis or is experiencing abdominal pain, it is important to seek immediate medical attention. Today's topic is sickle cell anemia. Sickle cell anemia is caused by a mutation in the HBB gene, which provides instruction for making a protein called beta globin. The mutation causes the production of abnormal hemoglobin, which lead to the formation of sickle-shaped RBCs. These RBCs are more likely to stick together and form clumps, which can block blood vessels and reduce blood flow to organs and tissues. This leads to tissue damage and pain, as well as increased risk of infection. It also causes symptoms of anemia like fatigue, weakness, and shortness of breath. Now the treatment is pain management and blood transfusion. Also, hydration is recommended. This topic is Huntington disease. Huntington's disease is a neurological disorder that affects the brain's ability to control movement and mental function. The most common symptoms of the disease include involuntary movements known as chorea, cognitive decline, and psychiatric symptoms. These symptoms usually appear in midlife but can start at any age. Huntington's disease is caused by a genetic mutation that leads to the death of brain cells in the basal ganglia and cerebral cortex. There is currently no cure for Huntington's disease, but treatments can help manage symptoms and slow down the progression of the disease. Medications such as tetrabenazine and antipsychotics help control chorea and psychiatric symptoms, and physical and occupational therapy can help improve motor function and quality of life for people with Huntington's disease. Today's topic is cystic fibrosis. So first of all, symptoms. There are two types of symptoms, respiratory and digestive. Respiratory symptoms include your chronic cough, wheezing, frequent lung infections, and also reduced exercise tolerance. Moving on to digestive, you will have malabsorption of nutrients and frequent diarrhea, also abdominal pain and vomiting. Cystic fibrosis is caused by the mutation of CFTR gene, which codes for a protein that regulates the movement of salt and water in and out of the cell. In people with cystic fibrosis, the CFTR protein is either absent or not working properly, which causes buildup of thick mucus in the lung, pancreas, and other organs. The treatment is your chest physical therapy and nebulized medication, which loosen and clear mucus from the lungs. Also, fat-soluble vitamins and pancreatic enzymes also given to improve digestion and nutrient absorption in people with cystic fibrosis. Today's topic is ADHD. ADHD is a disorder that includes symptoms of inattention, hyperactivity, and impulsivity. Children with ADHD may have difficulty paying attention, completing tasks, and organizing their work. The cause of ADHD is believed to be a combination of genetic and environmental factors. Treatment options for ADHD include medication, behavioral therapy, and lifestyle modifications. Stimulant medication like methylphenidate and amphetamines can be used to manage symptoms. Today's topic is Ankylosing spondylitis. It is a chronic inflammatory disease that primarily affects the joints and ligaments of the spine. It causes chronic back pain and stiffness in the lower back and hips. It can cause fusion of the vertebrae in the spine and inflammation in other joints and eyes as well. The exact cause is unknown, but it is thought to involve genetic and environmental factors. There is no cure for this disease, but treatments are available to manage symptoms and slow the disease progression. The drugs that mainly are used are your NSAIDs, DMARDs, biologic medication, physical therapy, and regular exercise. Today's topic is Anorexia Nervosa. It is an eating disorder characterized by significant weight loss, a distorted body image, and an intense fear of gaining weight. The disorder has both biological and environmental factors and is often triggered by a desire to control one's body and emotions. Treatment typically involves a multidisciplinary approach that addresses the physical and psychological aspects of the disorder, including medical monitoring, nutritional counseling, individual and group therapy, and medication. CBT has been shown to be particularly effective in treating anorexia nervosa.